Another uh, big issue that we run into here in Miami are toads, especially now that we're coming into the rainy seasons.
Mm-hmm.
And these famous Bufo toads. So,
Yeah.
have you encountered any issues with Bufo toads, and how have you handled that?
Yeah, we see it occasionally. We don't see it a lot in Coconut Grove, but definitely in other areas. I saw it all the time. So typically what happens is these big Bufo toads, they secrete a toxin. And when the dog, of course, all the little terriers are the dogs that get it the worst. You know, they go after the toad ferociously and get the toxin in their mouth, on their mucous membranes, on their gums, and it actually crosses through the gums. And it will cause, one of the first symptoms you'll see is they'll start salivating because it's very irritating, and sometimes they'll even vomit. So those are the early symptoms, which usually occur pretty much right away after they contact the toad. So sometimes people don't even see the toad, but they just find the dog outside salivating. And what we see when they come in is their gums are just brick red, really, really dark red. From that irritating toxin. And if they get enough toxin into their system, what happens is usually within minutes, I would say, they can start seizing and actually have seizures from this toxin. And in most cases, it's a good prognosis with quick treatments. Most of the cases we try to do our best to wash the toxin off their mouth. We treat the seizures, recover them, and most of them do well. It all depends on the amount of toxin they get most of the time. So I have seen a handful of cases that progressed and were very severe, and a few that didn't make it. But most of them do very well.
And Lory and I were chatting about the do's and don'ts of what to do if we do find them outside like that. I mean, should we do anything specific before taking them in?
Yes. So if they are not actively seizing, let's say you find the dog salivating and you suspect it just got a toad, or you saw the toad, what you can do is try to get the toxin off the gums, out of the mouth. And the faster you can do that, the less toxin they're going to absorb. So a couple ways to do that. One, if you are outside and there's a hose or a sprayer, you can spray water into the mouth. Just in that case, be careful that you're not spraying into the mouth towards the airways, because they can actually get water into their lungs that way. You would want to kind of spray from the side, or spray towards their nose, so the water's not going down the back of their throat, in order to rinse that toxin off. Or what we do in the clinic is, since we don't have a hose right here, we'll usually grab a handful of gauze, get it soaking wet, and just start kind of like mopping out the mouth back to front, wiping down all the gums in the mouth. And that's pretty effective. So if you have like a rag that you can just get it soaking wet and wipe out that mouth, you take the toxin off the gums, and sometimes they won't even progress to seizures. Of course, if they did get a toad and they're showing symptoms, you should go ahead and head towards a hospital. But if enough time progresses by the time you get there and they're not having symptoms, it depends on how they look by the time they get there.
Yeah, one good point is to make sure that you call the clinic and let them know what you're doing and what's going on.
Yes.
Prior to getting in the car and going, because once you get in the car, you don't want to call. You want to pay attention to the dog, wipe his mouth out, continuing while you're going over there. But call and get them on the phone so that they're ready when you get there, because they'll have everything prepared.
Yeah, it's always helpful to know what's coming in the door, and also we can ask if it's a big dog or a little dog, so we can just have everything ready to go as soon as you get there.
Yeah, that's happened to me and my personal dogs. They like to go after Bufo toads, and my little guy got into it, and you're stressing out. So it's better to know these things prior, because they're your children, and you're freaking out and like, what do I do? So knowing all this information is super important, and calling ahead for sure. They're waiting for you, and they just bring you right in because they know that it could become more severe. So